welcome everybody, and thank you so much for joining us for today's Ask an Expert session. If you don't know me, my name is Terry, and I am with Spinal Cord Injury BC. Today's session is about empowering lives, navigating lifestyle with intermittent catheterization. And we're really excited to have Vinder Nat here with us today. And Vinder has over 25 years of nursing experience, primarily in urology cystoscopy at Brampton Civic, which is in Ontario. She holds a nurse educator certificate and has taught nursing skills at George Brown and Humber College. Her knowledge and passion for health promotion through patient care and teaching has led her to join Coloplast Canada as a clinical specialist in Continence Care. With that, I'm going to pass it over to Vinder. Thanks, Vinder.
Well, thank you very much for that intro. And welcome. Good afternoon. I will start off by saying that we do have a disclaimer, and it is just to let you know that this presentation is meant to provide general information and educational information. So please follow up with your physician for guidance. We'll just skim over the agenda, which is intermittent catheterization and its benefits, what is a UTI and with signs and symptoms, maintaining a healthy bladder, navigating lifestyle with regard to intimacy, exercise, and travel. And then also just looking at what kind of things you should consider with personal selection of your catheter. And then we'll touch on Coloplast Care, which is a service that Coloplast provides for intermittent catheter users. We do have, and you will see this throughout the presentation, that there's a QR code with the heading of special guides and booklets that we have. So you can scan the code later on. We will also be providing the information and it will be available to you. But I just thought it would be nice to have it incorporated within the presentation so that you're aware we do have material for you. So we'll just talk about intermittent catheterization just briefly. And intermittent catheterization, it is just inserting the catheter and allowing the bladder to drain the urine that may be sitting there. It's probably sitting there from the inability to empty the bladder completely, but it's also a situation that can occur from the issues of a prostate blocking the bladder and the urethra from allowing urine to flow out. Oops. And or post-surgical interventions like a hysterectomy. And there are also cases where there is the inability to hold the bladder, so urine has to be drained out through a catheter. The benefits of intermittent catheterization: if you're already using a catheter and doing intermittent catheterization yourself, you'll probably understand and be aware of why you're doing it. But it is to improve the urinary symptoms. It's to give you control over your bladder and create that opportunity for you to have more independence in your life and increase your confidence with being able to feel comfortable catheterizing, not only at home, but outside as well. And we want to reduce the risk of urinary tract infections, kidney infections, bladder infections, and renal stones from developing. So we'll just talk about what a quickly urinary tract infections are. And the urinary tract is composed of the kidneys, which are part of the upper part of the urinary tract, and the ureters. And as you go lower down, the ureters drain urine into the bladder. And so the lower part of the tract is usually where the urinary tract is, the infections can occur. And we want to just remind you that the infections can be caused from improper handling of the catheter. If your hands are contaminated or if the catheter has been contaminated, reusing a catheter. So we don't condone that at all. We just want you to use a single brand new catheter each time you catheterize. And then also it is a situation that can occur from having too much retention and urine not draining completely from the bladder. So it remains in the bladder and it leads to an infection. And then there's also the fact that you have to keep the area clean. The genital area it's essential that you clean your hands and that you clean the genital area very well so that you're not risking any bacteria going onto the catheter and in being introduced into the bladder. And there's also the importance of, for females, wiping from front to back because the proximity of the urethra to the vagina and the rectum, there's that potential for stool to travel and also lead to urinary tract infection. And the little point that we want to emphasize is just that there are 3.5 urinary tract infections experienced by a catheter user. And, you know, we're very, very hopeful about reducing that number. So the importance of these kinds of webinars are there to encourage you and remind you of single-use catheters and hygiene. We'll quickly go over a couple of the signs and symptoms: fever, shivers, malaise, feeling weak or just unwell, a strong smelling urine, or even if you see a cloudy tinge to your urine, blood in your urine, pain, back pain, those are usually related to kidney. Any leakage, if you start to experience that, and that's from the bladder becoming full and you're unable to void on your own, or you're just not catheterizing as often as you should. Belly discomfort, and again, catheterizing more often. And in this regard, we mean that you are potentially catheterizing way more often than you need to, and therefore introducing bacteria. And we also want to be cognizant of the fact that there can be in the spinal cord injured population that at the T6 level and above, that there's a potential for autonomic dysreflexia. And what happens is the autonomic nervous system, it tends to create a high blood pressure situation, severe chills, sweating, anxiety. And it all comes from the fact that you may have a full bladder or constipated, and there is a fullness in the bladder, or sorry, the stool, the rectum. And in other cases, it can also be due to an infected pressure ulcer that hasn't healed well. And, whoops, sorry. This is our next booklet. It is Understanding Urinary Tract Infections. And again, as I said, we'll provide you the information afterwards. And we're going to get into discussing maintaining the bladder. When we get into the actual physical act of intimacy, I want to just point out that, again, speak to your healthcare providers so that you can get the guidance and information that you need in support of your next move into your relationship. But also that diaphragms and spermicides, they can cause some irritation to the genital areas. So be wary of that. And that's why I want to say, just make sure that you've spoken to your healthcare provider about it. And again, I've mentioned before that for women, it's essential to clean from front to back. And before sex, empty the bladder. There's a potential for leakage if you haven't emptied your bladder. So you want to make take the most of that opportunity to make it a beautiful and enjoyable experience. Set the ambiance with dim lighting, pillows, make everything as comfortable as possible for yourselves. And during sex, using water-soluble lubricants to avoid there being a lot of friction, but also, again, preventing urinary tract infection. And after sex, making sure that you're hydrating, keep that urinary system flushed. And you can do intermittent catheterization when you're ready to do it. And again, just keeping the area clean and washing the hands clean, keeping yourself hygiene. We have one of our ambassadors, Brittany, and I'll mention her in the sense that at the age of 13, she became a paraplegic and became independent with doing self-catheterization at the age of 18. And it was a different challenge for her to now learn to do it herself, but also thinking about herself as a woman and what her needs were, and engaging into a relationship and the several dating opportunities she had. And if you have experienced that, I think you'll be able to understand that it is a bit of a challenge to think about intimacy. And first and foremost, you have to kind of get over what your own emotions and your own feelings are, and be able to accept that this is, again, intermittent catheterization is a part of your life, as I mentioned before. So one of the quotes that I wanted to just reflect on was the fact that when she met her husband, she was able to share everything about herself with him and have that open discussion, which, as I said before, it's really important to be able to help that other person understand what you're experiencing and what your needs are. And we've got the QR code there. What this allows you to do is listen to her story and what her experience was with dating and intimacy. The webinar that this was done with Maureen Morgrath, who is a nurse and sexual health educator. And she was able to give some direction and further information on sex and intimacy with being in the paraplegic state. We'll get into travel, because I know a lot of times people want to travel, and there's a lot of places that you want to go, and we have to remember to keep ourselves prepared for any kind of emergency. And so travel, we want to make sure that you have a smart kit with extra catheters and towelettes or gloves and any kind of equipment, lubricant that you may need. Locating washrooms before you go to a venue, just because you don't know where you may be going or where you may have to stop, and is there a washroom along the way. Ensuring that you've got yourself prepared for that trip. Setting an alarm, if you've already got an alarm as to how often you do your catheterization, that would help. And it just helps to regulate and keep you in mind that you're going to be catheterizing at a certain point. So be prepared to look out for where there may be a washroom stop that you can make. Compact catheters are convenient because they're pre-lubricated, ready to use, discreet, and they can come in a kit. And what that means is the bag is already attached. So the urine just flows directly through the catheter and into the bag, and it can be discarded in the appropriate area. And storing products at the right room temperature. If your catheter is in a cold place, you can put it between your hands or underarms and rub your hands together to keep it warm. But we want to make sure that the catheter is stored as so it does not damage the packaging or lead to any issues with usage. And again, when you're traveling, make sure you have the name of the product. Take a picture if you need to on the phone so that you can avoid there being an issue where your luggage perhaps doesn't arrive and you've got catheters in there and you've only got a few with you. You'll be able to transfer your photos and your information about your catheters to a nearby pharmacist or to somebody who can get those products to you when you need them. And before you travel, order enough. Make sure you've got your supplies delivered to you before you start packing. Again, don't leave it last minute so that it doesn't compromise your ability to travel. And if you're going on an airplane, if you can request for an aisle seat, that might make it a lot easier for you to be able to do your catheterization. And certainly before boarding the plane, you'll want to catheterize. And carrying a travel certificate, I will show you what that is. And we also want to encourage that you think about where you're going. Make sure that whatever tourist site has washrooms available for you and is accessible to you. Because some places don't have the wheelchair accessibility. And there are also some places that will require you to pay for the usage of a washroom. So carry some loose change with you just in case that's needed. And bottled water, sometimes it's not as easy to get out to get water. So ensure that before you leave the airport or you get into a more uh, into a traffic area where you'll be sitting in a car or on a bus, that you have water with you, because that water will come in handy not only just to rinse your hands, but also to flush the bacteria out of your bladder and drinking that, keeping yourself hydrated. I did mention a bladder emergency kit. And again, it's just an aside. This you can keep in your car, keep it at work, but it has the essential pieces of tools and that you need, with the catheter, the gloves, the hygiene wipes, lubrication, antibacterial gel. And this is an example of what Coloplast has as a travel certificate. It's got your name, the supplies that you use, and your medical information. And there are various language: Portuguese, Italian, Spanish, English, and German and French. Just in case you run into a situation at security where they may be questioning what you're carrying. And this is a document that you can pull out to show them that you require these in your carry-on. And another QR code so that you can tap into information about traveling. And we'll get into the exercise bit, because we all want to keep fit and stay healthy. And you should not allow yourself to feel like you can't do anything. You can dance, you can go swimming, participate in sports. There's a variety of activities through the Canadian Wheelchair Association that you can participate in. And it makes you feel good, and you get a chance to socialize with others, joining into groups and teams. But just remember to do your intermittent catheterization before, and carrying water with you, because you're going to be sweating. You're going to want to keep yourself hydrated. And this is Leanne Taylor. She is the first Canadian woman to win a bronze medal in the paratriathlon that happened in 2024 in Paris. And she is a wonderful young woman, brave, enthusiastic, and an example of just not letting anything stop her. And so we want you to feel that empowerment as well, and take on whatever you feel that you can and enjoy that activity. As I said, there are associations. And one of the other things that you could do is just using it around the house. using hands, lifting them up and doing some arms exercise and keeping yourself toned. But if there is a support person available, then learning to do range of motion exercises so that you're not, again, allowing your muscles to become weak and flaccid. You want to keep that muscle tone, be able to keep yourself strong, and be able to do as much as you can. And again, another QR code for access to a booklet on exercise. So we'll get into talking about catheters and just the fact that everybody's different. So when you're selecting a catheter, your healthcare provider will discuss what catheters there are available, but also what's going on in your life, and try to accommodate what catheters are going to suit you at any given point of activity in your life. With meeting individual needs, we have catheters that are in different lengths, compact, and what that means is just being in a discrete form. There are catheter sets. I mentioned that before. They have the bag attached. And we have an example of how discrete they can be just based on this picture to show you that they can fit in the palm of your hand. And the catheters are, again, set up in different diameters so that they can be utilized based on your gender, your age, your dexterity, your condition, and just allowing the flexibility for you to navigate through the sizes, but also find what works best for you. And when we say age, we're talking about the fact that our catheter users can start off in childhood. So we want to make sure that there's a catheter to accommodate all ages and all sizes of individuals. There are a couple of things that we want to mention to consider, and that is whether you have adequate hand dexterity, hand function, are you in a wheelchair, what kind of design of a catheter would be the best for you, and are the catheters that you have fitting into your lifestyle? If not, you may want to discuss this with your healthcare provider to find out what's out there. And then also the changes that can occur through life with regard to home, work, health, and family. As I said, some of the users can be starting off as children, and that development leading into life, growing older, your catheter size changes, the length changes. And with home, there is also the fact that you may be moving. So you want to have catheters that are available to accommodate the different kind of lifestyle and home that you have. And with work, in the sense of having discrete catheters with you, or changes that happen in changing work environments, and then also health. And we all age, and so we develop health issues. And how is catheterization working out for you in that transition into old age, and what size and what type fits in for you at that point? Again, speaking to your healthcare provider to determine what is best for you. And I did mention that we have a triple action coating. This is an amazing coating that allows the catheter to stay smooth as it's being inserted and removed. There is less trauma to the urethra with the hydrophilic catheters, and our line are called the Speedy Cath. They are all hydrophilic. And we'll just give you a quick show of what our hydrophilic catheters look like under a microscope. That you can see the coating is along the entire surface of the catheter. And with other catheters, the coating tends to have spots where there are areas dried up. And so therefore you get a bit of trauma to the urethra, and it doesn't allow the catheter to go in and smoothly. And it is, again, looking at convenience and comfort for you with regard to being already lubricated and being safe for you to be able to insert and remove for the urethral tissue. And we're now getting into the final bits of this presentation, and that is to talk about the personalized support you can receive with Coloplast Care. So once you give us a phone call, you can receive emotional support, information on products and guidance as to products that you might want to use, and free samples. There are resources and tools that you can watch videos on catheterization, but also learning about the different products. And also we have a reimbursement specialist. Her name is Hannah, and her information is there, and she will go through your information with you to find out any eligibility for reimbursement. And she is fantastic. She will do everything in her power to find out where you can get support for your catheters. And one other thing that we've just started is an affiliation with Teladoc Health. And this is an opportunity to receive 3 1-hour sessions of mental health support. And it is with a professional counselor. These are virtual appointments. And once you sign up for Coloplast Care, the care advisor will give you some instructions on how to sign up, and she'll give you a unique code, which you can use to go onto the Teladoc Health site and go into their My Strength app and be able to receive complimentary education and support. And just so you know, Coloplast has no information on who calls Teladoc. We do not have any idea or information about who's calling, when they're calling. It is completely confidential between yourself and Teladoc. And that is the end. If you have any questions, I'm happy to answer.
So one question that I have is, I had heard that vaginal fluid is actually an antibacterial. So to not worry so much about if your catheter goes into your vagina first, to like throw it out and then you renew that. Do you know the answer to that?
That's a really good question. And I'm going to say that yes, I do believe that. However, being in the urology area for so many years, I always knew which hole to put it in. So it didn't really come across. But once you've cleaned the area, as long as there hasn't been any kind of contamination, and again, I've spoken about the stool and wiping front to back, but the essence is to make sure that you've cleaned the area really well. And if the catheter does go in, we do advise that you leave it there and get a new catheter to insert, so that it's a lot easier for you to landmark as well with where the urethral opening is. However, I would still probably speak to a urologist or the physician to ensure that if the catheter goes into the vagina, that it can be safely transferred and used put into the urethra.
Sorry, can I hear the question? My computer glitched on me.
Oh yeah, so Natalie, the question was, about vaginal fluids, and like what I had heard was that vaginal discharge or fluid inside the vagina is actually antibacterial, so that if you were to mistakenly put the catheter into the vagina and then put it into your urethra, that it isn't as worrisome as, like, to get a UTI.
So that's interesting. And so we've always, like, my assumption, like, there is definitely bacterias and things like that that are unique to your vagina, microflora there for sure. And introducing that bacteria that's native to the vagina then into your urethra could definitely potentially be problematic. Um, I don't know if there's a reduced risk or if there's some antibacterial properties. I haven't heard of that. I think there's a community of balance of good bacteria that every that those systems have. So, for instance, your gut bacteria. So, not all bacteria is bad; it can be good. But even bacteria that's good on our skin is bad if it gets into our blood. Do you know what I mean? So we have different bacteria within our body and in different body cavities. But when that bacteria leaves that body cavity and goes somewhere else in our body, it can become problematic. So I'd have to look at the research on that being safe. We've always been taught no, never take that catheter and insert it into the urethra. The idea is, even if you're poking around too much, you don't want to have your catheter touching all over the outside of where the urethra is, because there will be skin bacteria, right? And skin bacteria is not designed to be in our inside our urinary tract, right? So if we're touching the catheter on our skin, it gets on our catheter, and then now we go into our urethra. Now we're introducing that surface skin bacteria into our urinary system, which can become problematic. So I would say, based on that logic, I would say no, it's not a good idea. And just like Vinder said, leave the catheter in the vagina as a landmark. And then clean the area again and try again and using a new sterile catheter. So I would say no, that's probably not. But if there is any evidence or any research you have that supports that thought, absolutely would be interested to see it.
Yeah, I don't know, I just had heard that somewhere, so yeah, it was kind of interesting. I don't know if there's research, but who knows, we'll see. Maybe if I find anything, I'll send it to you, and vice versa. If you hear of anything, let me know.
For sure.
My other question is, and perhaps there's no research on this either, but I'm just personally curious why it seems like some people are more susceptible to getting urinary tract infections than others.
Oh, I'll let Vinder answer this, but yes, there's definitely research and there's definitely risk factors that we are very much aware of. And there is a publication on this from 2019. But I'll let Vinder, I'll let you speak to it.
Are you sure, Natalie?
Yeah.
No, okay, because I haven't read the research that Natalie's speaking of.
Yes, you have the Kennelly article.
Oh,
UTI risk factors model.
I thought you were going to be talking about something else. That, like, oh, okay.
No,
all right.
No.
No, first of all, everybody's different. So there's definitely a level of right there is a difference that and a potential for anybody to develop any kind of infection. But when it comes to infections, again, we want to emphasize that it's the hygiene of the genitals, the hand washing, the technique that you use, the way that your bowels may be impacting on your bladder as well. But again, just are you effectively catheterizing according to what your physician has discussed with you? 4 times a day, 6 times a day? Are you drinking enough fluids? Are you keeping yourself hydrated to flush out whatever bacteria may be pooling in the bladder already? And just again, making sure that you're using a single catheter each time. We don't condone the reuse of a catheter. We have Canadian best practices and European best practices to state that you should not be reusing a catheter, and it's a single use each time. And that I mean, Coloplast has an amazing hydrophilic catheter, so you want to minimize the urethral trauma by making sure that the catheter is lubricated really well and throughout, so that again, you're minimizing the risk of an infection happening.
Yeah, and I would just add there are two, like, so there's an article by the authors Kennelly, and it's published in 2019. It's on urinary tract infection risk factors. And they kind of divided the risk factors into 4 sections. So there's also what Vinder was talking about is 100% some of those risk factors right there. So how they're using the catheter. Are they reusing it? Are their bowels, are they constipated? Are they having fecal incontinence? Those things can increase the risk of UTIs. The other thing too is, do they have diabetes that's not well controlled? Are they female? The anatomy of proximity where the urethra is to the vagina and the anus, right? And have they had Botox injection into the bladder to help an overactive bladder? That can increase your risk of infection, urodynamic investigation. So this article really goes through it. And actually, I know Vinder will be doing a webinar on UTI risk factors model as well, explaining that as well. So we can let you know about that coming up too.
All right. Anybody else jump in? I can always keep going.
I was gonna say, I just like really quickly looked up like
The vagina
bacteria vagina thing, and the other thing to note is sometimes the flora of the vagina itself could be out of balance, and you could have an infection like bacterial vaginosis or something else going on. So I think because of all those reasons, it just, in my head, from everything I know about physiology and everything, it just doesn't make sense that it would be acceptable to put a catheter, a sterile catheter, into the vagina and then insert it into the urinary tract. But again, like, if there is any research out there, totally open. I just don't know. I can't find anything on my quick search, but I'll look around a little more.
I love it. My other question is with aging. So, I mean, I can only speak from a female perspective, but the anatomy starts changing. And I know that many women, especially, in menopause, it's much harder to do intermittent catheters. Is it the same with men, or is that kind of gender specific? And, is that a time when you would look at different catheter options? Like,
I think for the male population, it's usually the prostate that starts to become enlarged. It's inevitable. So I guess that's kind of their dealings with it. And I mean, the catheter will be a different one unless they have prostate surgery and the passageway has been opened up a bit better. However, we do have what's called the Coude catheter, and we have a specific catheter with a beautiful tip at the end that allows the passage, allows the catheter to just pass right past the prostate and into the bladder. Again, hydrophilic coating and uniquely packaged so that it is convenient, minimal touch to it. So for the men, they actually can pass this catheter in by not even touching the catheter itself because it comes in a sleeve. and being able to pass the catheter in. But yes, it's usually the prostate that I'm most familiar with that the gentlemen tend to have to deal with, and therefore they'll need that special catheter.
And I was just going to add, like, for the female perspective, I think that hydrophilic catheter, so hydrophilic just means that with SpeediCath line anyway, it has these, it has a tight bond of a lubricated coating on the surface that doesn't kind of rub off on insertion and withdrawal. So it keeps that catheter surface very lubricated to reduce friction. And in menopause, sometimes those tissues of the urethra, which are like the inside of our mouth, they dry up. They get more dry, more prone to injury and inflammation, potentially a stricture if there's enough inflammation and trauma, right? A stricture is a narrowing of the passage of the urethra, which makes it harder to cath. And so having a lubricated surface of your catheter is going to be really important. We know that when we add external gel, and we have videos on this, but when you insert that catheter, a lot of the gel collects at the opening of the urethra. So it doesn't even quite make it into the anatomy to kind of maintain that lubrication on insertion and on withdrawal, right? And if you're cathing quickly too, like in and out, there's a lot of friction because the average catheter user caths, if they're cathing 5 times a day, it's going to be 1,825 times a year, right? That's a lot of in and out, a lot of potential friction. So that's where the hydrophilic, for especially a woman postmenopausal or in menopause, might be good. Also, speak to your healthcare provider, but external estrogen type gels may be an option for a lot of women. Where they can apply the gel and it helps to keep that tissue more lubricated, more elastic, and healthier. And so it has a pretty low risk profile, but again, may not be an option for everyone. But speak to your healthcare provider about that. But that's a pretty common option that we see in menopausal or postmenopausal women for sure.
Mm-hmm. Okay. Thank you so much.
You're
Andy,
welcome.
I see you arrived. Do you want to ask your question directly to Vinder before we sign off?
Sorry, I'm late.
Hello.
I had trouble getting on the call. I'm technology challenged at times.
So am I.
I just sent a little message there, but one of the things that I'm retired now.
Yes.
And I'm hoping to travel more.
Okay.
My question was on products that are good for travel. Now I have ordered the SpeediCath. Matter of fact, I just had another box shipped today.
Okay.
But my God, I went away for a month in the fall. I spent $800 on catheters.
Oh wow.
Vacation.
Okay.
It's like adding an extra week to a holiday. And it's, I was just wondering, is there anything else out there that's maybe not so expensive? Would be my question.
Oh dear. That I mean there are other brands out there. I like, it would be up to you to try them out. You would have to your
if I can interject, I would highly recommend, we do have a reimbursement specialist. So if cost is a concern, we do have support through our Coloplast Care program. And they can speak to you as well regarding different options. And as far as what might be good when you're traveling, like let's say, you don't have an appropriate toilet or you have a long flight and you can't get to the bathroom. We have people that cath in their seat with the SpeediCath Compact Set, which is basically for males. It's a compact catheter and it has this telescopic technology. So the catheter expands and there's a bag attached. So you could technically cath without having a toilet or something like that accessible. But as far as price, it's hard for us to say what's cheap, what's not cheap, because depending on where you're purchasing your products, different retailers are going to charge different amounts. As well as if you are familiar with the care program through Coloplast, we do offer like free advice on navigating catheter coverage, whether you're using Coloplast or not. We have Hannah, who I don't know if you caught that when Vinder presented on her, but she is available. And after the webinar, we'll make sure you get her contact information. But she can navigate, or if you want a few samples and you want to try, just to kind of see, like before you go on vacation, does the compact set work for me, or do I want to try something different? Do you want to add anything to that, Vinder?
No, that's pretty much it. I mean, you've tried our catheter. I mean, yeah, unfortunately, it did cost you a lot. However, the convenience and the products that we do have are, again, designed for you to be able to travel and be discreet with your usage. So if you hadn't already tried the compact kit, then, our care advisors can send you some so you can try it. And as Natalie said too, that Hannah will be available to assist with looking at how you can get some reimbursement. There are some areas that we didn't even know of that she's able to tap into, and she'll go through everything that you have available to you first, and then explore other options.
That would be great. I mean, and it isn't just travel. I've been purchasing from chair stuff in town, and
Right.
before my vacation, I did have Steve did send me a bunch of samples,
Okay.
kind of the options out there. But I'm one of the unfortunate people that don't have any type of insurance,
Okay.
and so just the active cathetering is. I think I spent $6,000 last year. And I'm not even using, I mean, I'm adding lube and putting it on myself. So I'm trying to
Right.
go as cheap as possible.
Yeah.
Um, I have, I have started an advocacy group in BC,
Oh, good.
where we're trying to go after the government for some funding. Matter of fact, I just filed a human rights complaint yesterday. That in Maslow's hierarchy, I would think the right to pee has got to be in there. Um,
Yeah, for
right
sure.
right to pee for free. Whether we're
I
going to be
agree.
successful or not, I have no idea, but I will feel better if I at least try.
Yeah. Yeah. No,
Yeah,
I
we have a whole advocacy. We have a individual in a position called market access at Coloplast, and they worked with a ton of government agencies, and we're actively trying to advocate. We actually were a big part of working with Alberta Health Services to get their coverage improved in Alberta, and we're working with the Ontario government, and I'm sure she's had some talks with the BC, but yeah, we are definitely in support of having coverage for catheters, right? What's your advocacy group called, Andy?
Well, I think it's going to be called Catheters for Free BC.
Oh,
I
nice.
have kind of locked down the URL domain name of catheters for free bc.ca. So I am hoping to get a digital advocacy campaign going fairly soon, and compiling information on our domain, that people can look into. So I'm kind of hoping I can collect supporters throughout the province, and if we can strengthen numbers, it's something we can deliver to the government of BC to see if we can instigate.
Andy, do you have an email? Because I want, if you're okay with it, I'd like to share it with our head of market access, because they're all into doing advocacy and partnering with government, and I could share your email with her. Her name's Robin Frost, and see maybe if there's some information she has that might be useful for your group, or vice versa, or work together. I'm not sure, but is that okay to get your email?
I'm just typing it up for you right now. Yeah, no, that would be great. That would be wonderful. Any kind of help or anyone I can talk to would be great because it's all kind of new to me. I've never been
Sure.
politically active in my life, um, but this is something near it. I mean, you had mentioned, and really, I kind of want to fight for best practices for people, even people that do have some sort of government support, because it's still not sufficient in my viewpoint, what they are offering to people, whether it's
Yeah.
or that sort of thing. So
Yeah, well, that's awesome that you're doing this. We agree that it should be covered. So keep up the good work, and hopefully we can help you out with that too.
no, that would be great. Any help we can get or any information will definitely help our cause.
No, well, that's
Awesome.
amazing. Thank you for sharing your email because whatever we find out, whatever we can do, I know we'll do our best to get the catheters out to you, and everybody that does require them and doesn't have that financial support, because that's what we want you to do, is to be able to have a life, a quality of life, and enjoy, and not have to spend tons, as you said, like that was half a vacation right there too, right? The cost that you spent. So we don't want you to stress about that. We want to try to help you and make life as easy and comfortable for you, given the challenges that you do have with having to catheterize and whatever else may be going on, right?
Yeah. Well, thank you, and I am sorry I missed most of your conversation. I was really hoping to jump on this earlier.
So,
No worries.
one of the things that we spoke about will already be familiar to you, just with urinary tract infection signs and symptoms. But there are some QR codes, and I suppose Terry will be able to provide you the access to those pieces of information. They're kind of booklets, guides that again will reflect on intimacy, on travel, on exercise, and just living life with self-catheterization.
No, that'd be great. Terry, she's my rock star.
Uh, Hello,
Aw.
Lily. Hello, everyone. Sorry I interrupt. I just want to introduce myself. I'm territory manager in BC, and I am located in BC. So I just wanted to tell you, if you need anything, I can also provide you any service, any information, any sample that you need. I can share my email address here as well. You can have my number and my email address, and anytime if you need any support, I would be more than happy to help you.
Oh, that would be great. Yeah,
Yeah, sure.
definitely.
And Andy, I have a question if you don't mind. Have you enrolled through the patient care program for the Coloplast or no?
No.
Okay, no problem. I will get your email and I will send you the link. You can enroll through the care program, and from there, uh, you will have our support. Even if you won't use our product, still you have our support. We will send you some free samples, some devices if you need, and you can use some medical support, medical support with some specialists, and yeah, all the training videos are there. I will send you the link, yeah, via your email.
Okay. No, that'd be great.
All right, there we go.
Amazing. Well, thank you, all of you. Thank
All
you
right,
all for
you're
everybody for
welcome.
being here, and all of you from Coloplast that joined us to help us out.